Don't think healthcare professionals have any business experience? Think again. No topic is off limits as we share tales from our brave hosts who will always tell it like it is. We are #NoFilterHealthcare. Here to guide you through your healthcare journey are your hosts, Taylor Dunn and Tamara Donda. We want to thank our sponsor, Uptime Health, the leading healthcare equipment and compliance management software company, for bringing this podcast to fruition. Visit uptimehealth.com to learn more. Let's get started.
Welcome to #NoFilterHealthcare. I'm your co-host, Taylor Dunn.
And I'm your other co-host, Tamara Donda. And today we have our guest speaker, Rachel Wall, who is the founder and CEO of Inspired Hygiene.
Hey, Rachel, how are you?
Hey, I'm doing great. Thank you for inviting me on the podcast.
Of course, we're so happy to have you today. And I'm so excited to learn more about you personally and how you launched Inspired Hygiene. So let's get right into it.
Okay. So I am a hygienist, still a licensed hygienist in North Carolina, and I graduated from hygiene school in 1991. So a couple of years ago, I celebrated 30 years as a hygienist, which is kind of crazy.
Wow.
I don't know where that time went, but yeah, it's kind of wild. So I've seen a lot of things over the years.
Yeah.
So long story short, you were asking about how I started Inspired Hygiene, and I have been very fortunate to work in a lot of different types of practices over the years, and most of them being very progressive practices with dentists who invested in having coaching. And so I saw the impact that made on our practice, and I really liked how our coach was able to develop relationships with the team members and really make an impact on the practice as a whole. And so I actually was hired as an assistant to a coach that worked in a practice where I was working. And then she recommended me to another hygiene coaching group, which I worked for a couple years. And then I started Inspired Hygiene in 2004. And for the long time, it was me. I was the primary, only, and sole coach in Inspired Hygiene. And then, we really started growing through podcasting, through speaking, through just referrals and things like that. And so now we have worked with clients in 45 states, and we've been around for almost 20 years now. And there are 4 going on 5 coaches with Inspired Hygiene right now, and our support team as well. So we've been really fortunate to be able to just work with a lot of great practices and just continue to grow and do what we love to do.
Amazing. I love that.
Thank you.
And as I was looking at, your company and doing a little bit of research on the back end, as we do, just learning more about you on my own, I love that you are a hygienist, because I think it makes a difference when you're hearing from someone that's actually been there and has done everything that they're doing. And so I think it makes a huge difference. But one of the things that I just personally saw and it grabbed my attention is I feel like you do a really great job at addressing a situation where in a dental office, hygienists become they're great staff members. They're valued on a personal level, but they're not performing, and they may possibly need to check their competencies. And that's like a really hard situation to be in, because especially when you become comfortable in the office, and it may not even happen on purpose.
Right.
But I think any individual in any job, in any industry, go through lulls and sometimes need that reality check to get back on track. So I'd love to hear how you approach that when you're faced with that situation.
Yeah, so that actually happens quite a bit. I would say that is one of the triggers for a practice owner to call us is, hey, we've got a great team. Everybody's open to learning and growing. They work well together, but we need to get calibrated. We need to get everybody on the same page, is what a lot of times the dentists say. And maybe they say, I'm concerned about this one hygienist. I have actually heard this specifically, is that, another hygienist is seeing this hygienist patients, and they're concerned because there's calculus left after periodontal therapy, or there's just some things that are becoming obvious, and it is difficult to talk to the hygienist about that. I would say that's something that we have really taken heart, and we have some things in place for dental practice owners that want to do coaching, but they say, well, so how am I supposed to approach my hygienist with this when we're considering bringing on a hygiene specific, consulting or coaching firm like Inspired Hygiene? And all of our coaches are also hygienists. So, it's not just me. When they're going out in the field, like they can relate as well. And they have been in the position where, they had to evaluate their skills, their competencies, and how they were presenting treatment and what they were doing to identify the treatment that was in the patient's best interest, and then communicate to the patient and also to the doctor. So one way that we address that is we give the doctor some talking points to share with the team about what does this mean that I'm considering hiring Inspired Hygiene. And because they don't always know the best way to approach it. And we want it to be set up as a positive experience from the very beginning, right? We're not going in there to tell them what they're doing wrong or, to damage their relationships with their patients. We're going in to be an advocate for them and also to bring the hygienist and the doctor together. Like, okay, here are our common goals. What is the doctor frustrated about and want to be different? What is the hygienist frustrated about and want to be different? And how do we get both of them into a situation where they're both seeing things moving in the direction they want it to be in and reducing some of that stress? So we give them some specific talking points. We give them advice like, a lot of times doctors that hire us, most of them, probably 100% of them, honestly, have invested in high-level CE for themselves. And, as a leader, you can only do so many things at one time. So what they recognize is like, wow, we're practicing here, but we've not given that same attention to the hygiene department. And so now let's do that. And so that's one way that doctors can approach their hygienists, is to say, look, we've invested in this high-level CE for myself. I had to get out of my comfort zone with the way I learned to do certain procedures in dental school or in the early parts of my career. And I knew that there were new technologies, there's new knowledge out there, there's new science about, how oral health affects the overall health. So I want to invest in you guys too. I want to invest in the hygiene department and give you the tools to be able to practice at the same level that I am, and to get that satisfaction and our patients get those same, higher level outcomes. The other thing that we do before we ever have the coach go into the practices, they meet virtually like this with the team, and they just ask the hygienist, so what are you excited about with Inspired Hygiene coming in to work with you? And what are maybe you nervous about? And because that's totally normal. And I would say probably 80% of hygienists that we work with have some bit of anxiety or hesitation or nervousness about the coach coming in. So it's good to kind of get that out, air that out. And then a lot of times the coach can address it and just say, I understand why you would feel that way, and here's how we're going to approach that. And it really brings them comfort. So then they're not as worried. And then when the coach gets there, like, our goal is really to just get to know the team and to just really show them that we're there to help them and support them to getting to that next place. So, I'd say that's how we address that, Taylor, from that perspective of, maybe, like you said, they're great team members. They don't want to lose them, but we've got to up-level our skills. And we all have to do that, like you said.
Right. I love that you focus on the positivity that's involved in that too, because I feel like that's also the approach that a lot of people take, but sometimes you get into that negative space where you're bringing forward those lack of attention to detail or whatever it is that's triggering this to even come up. And so finding a way around that is really impactful. So I think that's really helpful.
And once we can illustrate, and they have an opportunity to experience working with us, then I think a lot of times the guard comes down, and they see some positive impact and results that are coming. And then we can say, hey, can we give you some coaching on a couple other things? Or here's something that might make your day-to-day a little bit easier. Are you open to trying it this way? So then we can start to address some of those other things. And we do, I don't think we probably share this well enough, but we do hands-on clinical training as well, with the ultrasonics and with Perio charting to make sure the team is calibrated. So we do a lot of those hands-on trainings as well, when there are even some of those clinical competencies that could be improved and just brushed up on.
Yeah, that's great. And I think it really matters because you're showing them that they can trust you. and
Yeah.
that you're there to help. You're not
Right.
there to take away any of the value that they provide. So
That's right. Yep. That's our goal.
well, let's get into the fun part here. So,
Okay.
my favorite part of the show, which is, hashtag no filter. Tell
Yeah.
us what we're considering to be that horror story or the story that kind of scares everyone into being more
Yeah.
compliant. I know you've got some, so I'd love to hear what those are. If you
Yeah.
have one for
Yeah.
us.
So yeah, as I was thinking about this, there are, two or three that kind of come up. And I'm sure there are more that we don't know about, right? That our clients don't share with us. But
Yeah.
one that came to mind was, and we have a lot of clients that, and I think this is becoming more common because of where we are in the industry right now with dental hygiene wages going up and dental insurance reimbursements going down, right? So dentists are like, okay, how can we make this work? Something's got to give here. We've got to kind of figure this out. And one way that they're approaching it is changing hygiene compensation. So they're going from maybe like an hourly to an hourly plus a commission, right? When the hygienist hit a certain point. And so this is actually years ago before this was so common, but this was a practice that had their hygienists on a commission, and their hygienists were very motivated by this. They were doing a good job with diagnosis and communicating to patients. But this one particular hygienist had pretty quickly figured out that if she could increase not only the care she was providing, but the number of patients that she could see in a day, then her income would increase, right? So, I mean, my feeling about that is, okay, fine. Like, as long as you are still staying within the parameters of the required diagnostics and the screenings and how we're handing it off and what our practice protocols are, then let's see what you can do. What we figured out was, though, in one time a patient came in and had anesthesia in the hygiene department. The doctor gave the anesthesia, and then the patient the next day had a I'm going to say a palsy event. So all of a sudden, like half of their face was kind of paralyzed, and it happened to be the side that they had anesthesia on. And so immediately when the practice is notified about this, they go back and they look at the treatment notes, and there were no treatment notes. So there was no documentation about what type of anesthesia was given, how much anesthesia was given, where it was given, and it turned out that this was not a dental related. It was something like a Bell's palsy, right? That is like a neurological thing. It was not dental related, but can you imagine how many nights sleep that dentist lost?
Oh my
And
God.
no
Yeah.
documentation is no defense. And what we found out through that is that the thing that this hygienist was often leaving out was treatment notes. So we had to start auditing and finding out that there were days that would go by where there were no clinical notes made. And so that's when we kind of had to pull back and say, look, you can't pack this many patients into a day. And I'm not there, I wasn't there every day seeing the level of care that was being provided. So, that's really up to the dentist. They're the ones that needs to be supervising that level of care. But that was something that was a pretty big eye opener for them. And fortunately, it all worked out. But no documentation is no defense. That could have ended very badly in a much different way. Yeah. The other one that I wanted to share, and I kind of prepped you for this, Taylor, is a couple years ago, we were working with a group of practices, and we were talking about the ultimate hygiene exam, which we teach, and the importance of having a very thorough oral cancer screening piece to that ultimate hygiene exam. And hygienists are in a really unique position that they get to do a lot of screenings, and some of them are literally life-saving screenings. And so we were teaching this in this group there were probably 15 hygienists in this practice. And one of the hygienists came up to me and she's like, so I've got to tell you, I feel kind of embarrassed, but I've actually had a lesion. I've had something on my tongue that I've been kind of concerned about, and it's been there for a couple years, and I haven't just taken the time to go have it checked out. And I said, okay, thank you for sharing that with me. I said, I'm going to ask you to get a referral from your doctor that you work with and to go see the oral surgeon next week. And I'm going to check up on this. And I immediately went over to that doctor. I didn't ask the hygienist's permission. I just felt really compelled. And I told her, I said, I may be breaking some HIPAA violation here, but this hygienist just shared with me that she's had this lesion on her tongue for 2 years. Can you please make sure next week that she sees the oral surgeon? This is really, really important. Turned out it was oral cancer. She ended up having to have part of her tongue removed and a neck dissection. And then I just found out last week that she passed. So a very serious, right, horror story. And all of that to say that not only is it super important for us as dental professionals to be doing these screenings on our patients, it's also super important to do them on each other.
Right.
And, I'm a hygienist and, I was with some friends last night and they were like, so like, do you go in and when you work in a dental practice, do you get your teeth cleaned every month? I'm like, no, we get in, whenever somebody cancels, we jump in the chair and, they kind of do a fast job on us. So I think that's really important is we've got to really value our own oral health and our overall health just as much as we value what we give to our patients. So, it's a tough story, but one that hopefully will, compel us to do better.
I think it definitely will resonate with some people, and especially me. I mean, I don't come from dental.
Yeah.
But I've learned over the years, just being in healthcare in general, how important oral health is.
Yes.
But over the last year, really doing a deep dive into dental, it's been very eye-opening for me. And just, what can happen, you don't even realize.
Right.
And it's just amazing. So I completely,
Yeah.
I resonate with that story, and I've been trying to educate my own family because
Yep.
what's scary though is my family, my immediate family has no clue about oral health. And it's alarming.
And I think it's gotten better because we have just more media in general now,
Right.
So, and the oral systemic link, the science that has come out over the last decade about how oral health influences our overall health has been, and I've seen it in Oprah magazine, I've seen it in Better Homes and Gardens, so it's in mainstream media now, so it's a little bit better, but I think that's probably more common than we would like to believe as dental professionals. This is something that we live and breathe every day.
Right.
But most people don't. And most people avoid going to the dentist, or it's not something that they really look forward to. So I tell everybody, if you don't know if you're getting an oral cancer screening at your dental office, ask your provider.
Right.
And, so did you do an oral cancer screening? And can you check this area? And that really should include an extra oral cancer screening as well, just feeling for lymph nodes and things like that, because there's a lot that can be detected there. And for our dental professionals listening, if you're a hygienist and you're saying, well, I'm not equipped to diagnose or to detect oral cancer, that's not the point, right? The point is just to discover that something is different and not normal, and then take it to the next level to that expert that is in a position to diagnose that and to make a judgment on that. So, we've got to start with these simple screenings that can really make a huge difference.
Life-changing.
Yeah, absolutely.
Well, I appreciate you sharing that story.
Yeah.
And one of the, it's kind of brought up that point in my head, I'm thinking education, right, is super, super important. I think we are in an industry where there is a lot of lack of knowledge, right, across the communities. So really trying to push that out there is what a marketing person is really there for. So I don't know if you know this, but I run marketing efforts for Uptime Health, and I always try to squeeze in a little bit of marketing knowledge for our listeners. And one of the really interesting terms, I was going through LinkedIn and certain marketing efforts, and they have this term called marketing hygiene.
Yeah.
And it's nowhere related to dental hygiene specifically, but it's essentially when you go through a business, you run an audit, you check their SEO, you check their social media, you really, kind of comb through everything that they're doing from, the day-to-day basis, from a digital media standpoint.
Mm-hmm.
You run a similar audit when you first, happen to talk to a client. You're like, hey, okay, this office needs A, B, C, D before we can even start.
Yeah. Yep. We absolutely do that. So we do it in a couple ways. One is we do, when we talk with a potential client first, we call that a hygiene opportunity assessment, and we collect just a little bit of data from them so that we can see some of those immediate areas for growth and show them a return on investment if they choose to move forward. The next step is when a client chooses to engage with us. One of the very first things that we do if they were interested in coaching, like personal coaching where we come on site, is something we call our hygiene growth roadmap. And that really is an audit of multiple key areas in the hygiene department. So recare and scheduling, supply and demand. We do a virtual chart audit, to see, are they doing that documentation? How detailed is it? Are there x-rays, of diagnostic quality? And when they're doing a Perio assessment, are they then treatment planning those patients that have indicators of active disease? We look at profitability and fees and their service mix. So yes, we do that deep dive, really looking at where they're doing well and where they have opportunities to improve and grow.
Yeah, it's absolutely important, to really just kind of sit back and build that foundation so that when you start adding in more and better sustainable practices, they can kind of build off that strong foundation. So another really popular question is, a lot of dental professionals, even healthcare professionals, are really interested in growth, right? Over, patients, any marketing efforts that they can do. And I have seen one of the largest and most sustainable marketing efforts come from conferences. So actually interacting with people and meeting them. So what is kind of your step to get that dental professional in front of those conversations, either a speaking engagement or just kind of building their reputation in the industry?
Well, you bring up a great one, conferences, right? So I have, hygienists ask me all the time, like, how do I get into speaking or sales or something like that? And I mean, where better to go where you have, hundreds of other vendors and things like that are there. So I would say conferences are great. Be prepared and find products that you really love and you use. So team up with some of your favorite manufacturers because they're always looking for dental professionals that are using their products and are willing to share their experience with others. So that's one thing. And you can do that at a conference. You can go to those booths and just say, hey, you know what, I'm a user and I'm also a presenter and I'd love to be able to share your product. Who do I need to talk to, about that? So that's a great way to do it because now too, with so much virtual speaking, they might have a webinar series that they do for their customers and you could be a speaker there. So that's a great way to start. I would say reach out local, be willing to, talk to the local study clubs, be willing to start doing that at, low or no honorarium. That's what I did. And you'll be surprised how some of those individuals that are in a local study club, they might be selecting the speakers for their state association or a regional association. And then once you start getting to something like that, then you're going to have scouts for the national conferences, the big conferences. One of the other things that I did very early was I joined an organization called the Speaking Consulting Network. And so I strongly recommend that organization as well as a great way to get started.
Awesome.
Yeah.
I didn't even think about that, how they make the progression from the study clubs and how that moves through the system of speaking. It's
very
really
interesting.
good point.
Yeah. And some of the bigger conferences will not hire a speaker unless they have seen them speak, which means they have scouted them. So all of the big conferences like Chicago Midwinter and CDA and Florida and Texas, they all send scouts to all these other meetings and they go in and out of speaker rooms and they find speakers that way. So, you never know when there might be a scout there.
Very true. Well, Rachel, it was so great getting to know you and how you're changing dental hygiene standards and practice. But before we say goodbye, I'd like to have you tell us about Perio Protocol Online Bootcamp you're hosting and how our listeners can sign up.
Yeah, so this is an amazing program that we've been offering this for years, and now we're taking a full 2023 redo on this. And so this is the new version is going to be launched in January 2023. And anyone who's interested can go to periobootcamp.com and just get on our interest list. There's no obligation, but you'll learn when it's open for folks to join. And it is a pre-recorded boot camp that practices purchase, and it helps them develop their own Perio protocol. It really helps them get their team on the same page, gives them some insight into that oral systemic link and the science behind that and why it's so critical for us to identify, this infection and recommend treatment, and also gives them some practical verbal skills, scheduling skills, coding skills, all the things you need to create your own Perio protocol. And all of our coaching clients, our private coaching clients, have been going through this program for years. So we're excited to open this up and launch this to other dental teams, that they can really bring this in either as a stair step to coaching or a DIY approach to do that. So yeah, just check out periobootcamp.com.
Very cool. Well, thank you so much. And to learn more about Inspired Hygiene and the Bootcamp, you can also visit inspiredhygiene.com. And don't forget to subscribe to our podcast or comment below if you have any questions for us. Thanks, Rachel.
Thank you.